Hey guys, so today we're going to be going over the basic anatomy and physiology as well as the blood flow through the heart and to the lungs and the rest of the body. I'm going to try and keep it simple. It's very broad overview. Additionally, I'm going to give a quick clinical presentation as to how someone with left or right-sided heart failure would present. And this is just to further solidify why it is important to understand the anatomy and physiology of the heart. Additionally, I'm going to have my notes in the description below. Feel free to use them. With that being said, let's get started. Deoxygenated blood, so blood that's been used in the tissues, in the brain, in the gut, in the spine, lower extremities, the muscles, all of that blood is going to flow back in the veins back towards the heart. So deoxygenated blood is flowing from the veins to the heart, and once those veins get towards end up going towards the heart, they're going to flow into the superior vena cava if they're coming from the superior portion of the body, or essentially anything above the heart is going to drain into the superior vena cava. So think superior vena cava above the heart, and then anything below the heart, all of those veins are going to drain into the inferior vena cava. So you have the superior vena cava and the inferior vena cava. Both of those are going to connect to the heart and drain into the right atrium. So we have the right atrium. So the superior vena cava and inferior vena cava are draining into the right atrium. Now, as a general rule of thumb, as long as there's no birth abnormalities or trauma or any other pathology going on, your right side of the heart is going to be your deoxygenated blood, and your left side of the heart is going to be oxygenated blood. So right side deoxygenated, left side oxygenated, because the left side returns blood from the lungs where it was just oxygenated. Through the flow of blood through the heart, I just want to briefly touch on the four chambers of the heart: right side and the left side, and then you have the right atrium and the right ventricle, as well as the left atrium and the left ventricle. So two atriums, two ventricles. I always thought of it as A over V, atrium before ventricle, because I would get confused. Are you flowing into the ventricle first, or are you flowing into the atrium first? So just know you're flowing into the atrium. The atrium is going to drain into the ventricle. So think AV, and then you also have an AV node, so that's like a 2-for-1. We love the deals. So we're in the heart. We're on the right side of the heart, right here in green, right? We're in the right atrium. From that right atrium, we're going to flow through the tricuspid valve, which I have labeled in dark green here, and that is an atrioventricular valve. And then from the tricuspid valve, we're draining into the right ventricle. Now from the right ventricle, which I'm circling here, we're going to flow into the pulmonary trunk. So we're on our way to the lungs, pulmonary meaning lungs, right? So we're flowing into the pulmonary trunk, and we're going through the pulmonic valve, which I have labeled there in purple. Bear with me, there are third graders that draw better than me. So we're in the pulmonary trunk now. That pulmonary trunk is going to divide into pulmonary arteries. So we're going to the pulmonary arteries now, which will flow to the left and the right lung. Now keep in mind, this is a pulmonary artery, and despite that it is an artery, it's actually carrying deoxygenated blood, right? Whereas most arteries in the body carry oxygenated blood, this is carrying deoxygenated blood. But think arteries away from the heart. Arteries away from the heart, veins towards the heart. So we're in the pulmonary artery. That pulmonary artery is flowing to the lungs, where it's going to form capillaries on the alveoli. So the alveoli are it's the gas exchange portion of your lungs, right? So I have the alveoli here. Here it's kind of like a grape cluster, but the gas exchange is occurring here at the level of the alveoli. You're breathing in oxygen. The oxygen that you're breathing in is flowing down into your lungs, down into the alveoli, where oxygen will then flow into your capillaries, and that carbon dioxide that you've been carrying in that deoxygenated blood will flow down its concentration gradient. So there's less carbon dioxide in the lungs, so carbon dioxide will flow out, oxygen will flow in. So now that we've got that blood oxygenated, we're going back to the heart via the pulmonary vein. Remember, vein is towards, arteries away. So now we're in the pulmonary vein. We're going back to the heart. That pulmonary vein is going to drain into the left atrium. So the pulmonary vein drains into the left atrium. From the left atrium, we're going to flow through the mitral valve, also known as the bicuspid valve, because there's two, whereas the mitral valve, whereas the tricuspid valve has 3 cusps, the mitral valve has 2 cusps. And that's another easy test question. So something to keep in mind is you try before you buy. So normally you're going to go through the tricuspid valve and then the bicuspid valve or the mitral valve. Again, left atrium going through the mitral valve, and now we're in the left ventricle. So from that left ventricle, keep in mind that that left ventricle not only has to pump blood to the rest of the body, but it has to be able to send that blood from the rest of the body all the way back to the heart. So think about pumping blood to your feet and all the way to your toes. Well, that pressure has to be high enough to where it can get back to your heart. So we're in the left ventricle, and now from the left ventricle we're pumping, we're squeezing all that fluid out. We're going to the aorta. So from the left ventricle we go to the aorta, and we pass through the aortic valve. So all of these different valves, essentially like the aortic and the pulmonic valve, those are going to correlate with the major vessels that they're going to. So for example, when you go through the pulmonic valve, you're going to the pulmonary trunk and the pulmonary arteries. When you're going through the aortic valve, you're going through to the aorta, and from the aorta that blood's going to pump to your brain and go down to your stomach and everywhere else in your body. So it's pretty incredible. The fact that your heart is pumping, let's say the average heart rate is 60 to 100 beats per minute, and that's pumping until the day you die. Pretty incredible machinery, a beautiful organ. Now that we've gone over the basic anatomy and physiology of the heart, let's talk about, just briefly, giving an example of why it's important to understand this. So let's say we have left heart failure. So we're on the left side of the heart. That's where your oxygenated blood is, and for whatever reason, this left ventricle, it doesn't have to be the left ventricle per se, but in this example we're gonna talk about the left ventricle. It's not pumping efficiently. So this light blue I have here, that's gonna be your blood, right? So normally you're pumping out that blood into the rest of the body. Some does remain in the left ventricle, but if this left ventricle is not pumping efficiently, that fluid and blood's going to build up, right? Well, eventually that fluid, it's like a highway system. When there's congestion on a highway or there's an accident, that fluid is going to build up just like traffic would build up, and it's going to flow backwards. So now that fluid is going from the left ventricle going into the left atrium. Well, guess what? If you keep going, that left atrium and that fluid builds up, it's going to go through the pulmonary vein. You're going to get fluid and pressure build up all the way back to your lungs, right? And so if we have all this additional, if we have poor flow through the lungs, you're going to get decreased gas exchange. So your patient might present with shortness of breath, trouble breathing. They may even have pulmonary or lung infiltrates or fluid seen on x-ray, and they can have additional symptoms. It's important to understand the anatomy because it can help guide you to what area of the heart is having an issue, right? Well, let's say that fluid keeps building up. This is just becoming a chronic problem. That fluid's backflowing all the way to the pulmonary artery, down the pulmonary trunk, into the right ventricle. Now we're on the right ventricle. We're in the right side of the heart. All that fluid's building up. Well, guess what? It keeps going into the right atrium. Now we're going back through the superior vena cava into all the veins of the upper extremities. This is where you might see your patient present with JVD, jugular venous distension, which is just you have a big jugular vein in your neck, right? And so there's all this excess fluid in that neck, and you can physically see that on your physical exam, which could indicate right or heart failure, right? And then if we go inferiorly down through the inferior vena cava, all that's going to lead to is drainage into excess fluid buildup or backup in your veins into your abdominal organs. So they may have nausea, constipation, or abnormalities there, because again, that blood exchange blood's not pumping efficiently, therefore the organs aren't going to be getting the appropriate nutrients they need. And guess what? Let's keep going, building up fluid, draining, backing up into the lower extremities. Now you have edema or fluid buildup in the lower extremities. So their calves or ankles might look swollen because all that fluid backup is backing up into the legs. So on physical exam, again, you would see like fluid buildup or edema in those legs, which would indicate right or heart failure, right? We just talked about left heart failure. So left heart failure, the symptoms are going to involve the lungs, right? Where right heart failure, the symptoms are not going to involve the lungs because it's happening before the lungs. So there's no fluid buildup in the lungs. So if it's just our right side failing over here, we have that fluid buildup in the right side of the lungs. We're getting all those other symptoms, the nausea, vomiting, peripheral edema, whatever that may be, but you're not getting shortness of breath per se because the lungs, there's no fluid buildup in the lungs. So on physical exam and with history and physical, it'll kind of help you determine whether you have left-sided heart failure or right-sided heart failure based on their signs, symptoms, and clinical presentation. So I'm putting here left heart failure for lungs, so lung symptoms, and right heart failure for roads, right? Or like your inferior vena cava, your superior vena cava. Additionally, I've put on my notes, I'm not going to go into too much detail, but on my notes I put additional information on the valves that are involved. The 4 valves: your tricuspid valve, your mitral valve, and then your semilunar valves. Semilunar because they look like a half moon. Your pulmonic valve and your aortic valve. So I put some additional information here. Not going to touch on it too much. And then just briefly, let's do a quick recap on the blood flow through the heart. So again, deoxygenated blood coming in, flowing into the superior vena cava, inferior vena cava. From that, it's going into the right atrium. From the right atrium, it's going to flow through what valve? The tricuspid valve. From the tricuspid valve, we're in the right ventricle. We're going from the right ventricle to the pulmonic valve, flowing into the pulmonary artery, and again, artery away, right? So that blood is being carried away from the heart towards the lungs, where it's going to be oxygenated. Once you're in the lungs, you're getting oxygenated in here, in the alveoli. Now that blood has oxygen, so we're ready to carry it back to the heart. We're going to the pulmonary vein. From that pulmonary vein, your pulmonary veins are going to drain into the left atrium. From the left atrium, they're going to flow through the mitral valve into the left ventricle. From the left ventricle, they're going to flow through the aortic valve and into the aorta and the rest of the body. Hey guys, thank you so much for watching. I really do appreciate it. I hope it helped you. Please like, comment, and subscribe.